From our 22 News Broadcast Center, this is 22 News in Focus.
Welcome to 22 News in Focus. I'm Don Schiffman. The State Department of Elementary and Secondary Education has unveiled its guidelines for reopening schools this fall. There are directives concerning health and safety that have to be met, but it leaves open room for superintendents to create specialized learning plans to meet their district and their students' needs. Teachers and parents have their concerns as well. So on today's program, we're going to be discussing the ideas that teachers have for planning for reopening of schools. And joining me now is Mary Najimy, the president of the Massachusetts Teachers Association. I want to thank you for coming on the program.
Yeah, this is such an important topic.
It really is.
I
know so many people want to learn so much about this, specifically parents out there. You issued a response to the state's guidance on reopening. What were your points that you feel need to be addressed right now?
Yeah. So first and foremost, there is consensus among educators, students, families, the medical community, the department, that the best way to learn is when educators and students are together in the buildings. However, it cannot come at the risk of health and safety, and we believe that the commissioner's guidance, despite that it's supported by some medical professionals, still does not meet enough health and safety standards to move forward.
And can you be a little bit more specific about that? Because, you know, we've talked with superintendents. They say that they have nurses in the buildings. They have hand sanitizer. They have all the proper PPE. They're even going to be handing out face coverings to students who perhaps forget theirs when they come to school or simply can't afford one. Yeah.
So there are multiple factors that have to work together. First and foremost, the standards on physical distancing have been relaxed. To imagine that we can put 20 kids in a room of 750 square feet at 3 feet physical distance is really impossible. That's one big problem that we have to solve. We have had over 2,000 layoffs of educators in the last, just as of June 15th. We cannot go back to school safely with fewer adults. Not every building, particularly in communities of color, have nurses. So we need more nurses, more counselors, more custodians. If fewer kids can get on buses, we're going to need more buses and bus drivers. And none of this can happen without full funding of public education.
Why do you think the social distancing standards are being relaxed? Because like you mentioned, and I heard this directly from the superintendent of Springfield City Schools, that the state standard is going to be 3 feet, but we're hearing in the news, we've been telling all of our viewers that everyone should be doing 6 feet of social distancing. So why would it be different with our children?
Yeah, our children are even more vulnerable, and not only are our children more vulnerable, but the educators that teach them are also vulnerable, and some of them are in high-risk categories and live with family members who are in high-risk categories. So what seems to be happening here is the commissioner is picking the science to justify his reopening plan to suit the lack of state funding, versus the state really stepping up and putting forth not only the Student Opportunity Act as baseline funding, but far more money that it's going to take to cover protective equipment so that we can have a safer reopening plan.
What are you hearing from your membership?
There was not one person who was at all happy about the recommendations. The range is from fear to outrage to a sense that we are rushing into a plan. Many educators are saying it's beginning to feel like they're science experiments. And the question that is being asked right now amongst educators and many families is, if we are phasing in opening of the economy, why are we not phasing in opening of public education?
But what I'm hearing too, though, is that there's room for flexibility here as they move throughout these stages, for example, and superintendents are being directed to be very flexible. So if numbers go up, for example, they're going to pull back. More students will be maybe taught from home, for example, remote learning.
So even though there's flexibility, the fundamental things we have to understand is it takes full staffing and more staff than we already have. If there are some kids learning at home while others are in school, is the teacher supposed to do two sets of learning at the same time? We need more money. We cannot do this on a shoestring budget, and that is what the state is expecting us to do.
Do you feel like there's a lack of communication? Because I bring that up because you mentioned that one aspect where you question whether that teacher is going to be responsible for two different lesson plans, for the lesson plan for the students who are in-house and a lesson plan for the students who are remote learning.
You know, you can't do more with less. That's one of the things I can't emphasize strong enough. No matter how much flexibility is built into the plan, if we don't have full funding and full staffing, we cannot return and safely.
What happens next now with all of this? Because does this mean it's going to happen? Or if there's enough pushback from your organization, could things change?
Right. So many things actually have to happen. The Massachusetts Teachers Association is working directly with the commissioner now, trying to negotiate real guidance and standards and regulations that bring consistency. At the same time, we are supporting each and every one of our teachers' unions at the local level to engage their families and their communities and work with their superintendents to create a plan. But the most important thing has to be we have much more consistency and much more safe regulations coming out of the department. And we are really working at that level as the MTA.
We're going to continue our conversation after a short break. You're watching 22 News in Focus.